So, our anatomy has started from now. So, when we will start from the base, the images of the skull will go away and then the images of the vertex of the skull will remain. So, when we will film the CT scan head images, the first images will be from the base of the skull and then slowly to the superior part of the skull or vertex. So, we first starting the anatomy from the base of the skull. So, this is not an image of the base of the skull. But these two images show you the different window in the head CT scan. The first image is a brain window or soft tissue window. The second image is a bone window, which shows only the bones. The third image is a brain window, which shows only the bones. The second image is a bone window, which shows only the bones. So, if we start the anatomy from the brain window, we can see two orbits. The bone density is very simple. The bone density is plus 1000. The bone density is very simple. The bone density is plus 1000. The soft tissue has a medium density like 50, 100, 100. The water density is near to 0. The water density is near to 0. So, we have to keep in mind which things are dark in CT scan. The dark things in CT scan are air, which is black. The dark things in CT scan are air, which is black. The dark things in CT scan are fat. The dark things in CT scan are fat. The fat is very dark. The fat is very dark. So, the fat is behind the eyes. Posterior to the orbit, there is fat. But the fat is dark. So, the fat in CT scan is dark. The dark thing is water. The dark thing is not so black. It is not black like air. But it has a water density. It is gray. The bones in CT scan are white. The bones are white. The bones are white. Then, what happens if there is any calcification? Calcification or any stone, it will be white. Calcium is white. Metal is white. What else will be white? Contrast. What else will be white? What else will be white? Hemorrhage or blood. There is bleeding in the brain. So, if there is bleeding inside the brain, then the bleeding will appear as a bright signal. And another one is the contrast. The contrast is that the contrast will show as a bright signal in the image. So, the black signal comes from air, fat and water. And white signal comes from bone and then blood, contrast, any metal, etc. An intermediate signal, that is, the intermediate signal is the soft tissue. The tissue of the brain, the tissue of the organ, liver, stomach, spleen, etc. From these soft tissues, we get the intermediate signal. We will go to the next slide. Now, we are at the base of the scale. So, we started from this sinus and here is the medulla. So, first of all, there are two maxillary sinuses on these two sides. And this is our nasal septum. And this is the zygomatic arch. So, the zygomatic bone next to the maxilla is the zygomatic arch. And this is the bronchial bone, which is located in the middle of the nose. And behind the bronchial bone are the nasopharynx. We know that our nose is nose-shaped, and our nose is nasopharynx, larynx, pharynx, and goes through the nose. And this is the mandibular condyle. We know that the mandibular is the temporal mandibular joint. So, the temporal bone's groove is located in the mandibular condyle. This is the mastoid bone. So, we know that the mastoid has air inside it. These black things are air, or the air that goes through the mouth. And here, we can see the two arteries. And here, we can see the vertebral artery. As we have contrasted the two arteries, we can see the arteries clearly. And here, we can see the medulla, which is a part of our brain. We move to the next image. Now, we are moving up a little. We were here at the nasopharynx level. Or, at the nasopharynx level, or at the maxillary sinus level. Now, we are moving up another slice, which is at the orbit level. Now, we are at the orbit level. The first thing that is inside the orbit is the lens. And the fluid that is inside the orbit is called fluid, or water, or Bittgrass fluid. And behind the orbit is a subtissue, which is the optic nerve. And this is the temporal lobe of the brain. This is also a temporal lobe. And here, we have the atari of the basilar. We can see the contrast between the two arteries. We can see the white part of the enhancement. And the CP angle. CP angle means the cerebellum and the pontal. The cerebellum and the pontal. These two angles are the CP angle. Sometimes, the CT and CP angles are the tumor, or the bestial tumor. Then, the pontal, or the brain's pontal. Then, the vermis of the cerebellum. Now, we are at the frontal sinus level. The frontal sinus is above the eye. The frontal sinus. We know that sinus is the foci zone. Foci zone means the area where the brain is. This is the frontal sinus. The area where the brain is black. And the bones are white. This is a part of the frontal lobe. This is the frontal lobe. Here, we have anterior tendoids. And here, we have the sella. The sella is the place where the sella is. Here, the pituitary gland is present. And here, we have the infundum. This is a part of the pituitary gland. And the atari of the basilar. This is the tendorium cerebellum. This is the fourth ventricle. Here, there is a CSM flow in the fourth ventricle. We have gone up another slide. Here, we can see the frontal sinus. Then, we can see the frontal lobe of the brain. The frontal lobe is bigger. This is the basilar frontal region. And here, the MCA, the middle cerebral atari. As we have contrasted, the atari are also contrasted. And we can see the atari in the contrast. This is the MCA. This is the MCA. This is the MCA. And the suprasellar cistern. This is the place where the cellar is. This is the suprasellar cistern. Here, there is fluid. This is the posterior communicative atari. This atari here is the posterior cerebral atari. This is the posterior cerebral atari. This is the superior cerebral peduncle. This is the superior cerebellar peduncle. We are going up another slide. Now, we are at the circle of Willis level. Circular bullies are the blood supply of our brain. It is a good thing through the circle. The blood circulates through the circle. One part of this circular bullies is anterior communicative artery. We can see these two arteries. This is anterior cerebral artery. The anterior cerebral artery is the blood supply of the frontal lobe. The two arteries are anterior communicative artery. This is the small line on the mask. This is anterior communicative artery. This is the left middle cerebral artery. The left side of the brain is the blood supply of temporal lobe and parietal lobe. This is the basilar artery. The basilar artery is the posterior blood supply of the brain. This is the posterior cerebral artery. We are on the upper side of the brain. This is the basal ganglia. This is the basal ganglia. This is the insular cortex. This is the ambient system. This is the optic chiasma. The two optic nerves are connected. This is the optic chiasma. This is the interpeduncular system. System is the area where water is present. This is the C-shape. This is the quadrigerminal system. This is the right C-shape. This is the quadrigerminal system. Next slide is the Fisher system. Hippocampal gyrus, interbedding color system, optic charisma, cerebral pithuncle, quadridimensional pellet, superior cerebellum. Here we have cerebellum, superior cerebellum. This is temporal lobe, and this is frontal lobe. Now we have another slide. I am going to show you the upper part of the head. First we have to see the fat, subcutaneous fat, which is black. Fat and air are always black. Now this is frontal lobe. This is pericallosal artery, which gives blood supply to the frontal lobe. This is Sylvian fissure, fissure means A. This is temporal lobe, aqueduct, ambient system, cerebellar vermis. Here we have cerebellar vermis, and here cerebellum is at the end. This is occipital lobe, we know it from the back. Now we have another slide above. This is real basal ganglia level. This is basal ganglia, and this is basal ganglia. Here we have some problems due to pathology. We have some anatomies of basal ganglia, like external capsules, internal capsules, insula. We have septum pellucidum, which is the brain, which has a mask. This is third ventricle, and this is pineal glar, which is cerebellar vermis. What is there in basal ganglia? There is sputum main, and chordate head. These are the problems due to pathology. In the next slide we see the lateral ventricle, the anterior horn. This is the front part of the lateral ventricle, which is black. Here we have an internal capsule, which is a part of basal ganglia. Here we see genus, which is a part of the corpus callosum. This is genus. This is the internal capsule, which is a part of basal ganglia. This is chordate nucleus, lentiform nucleus. This is the posterior side of the lateral ventricle, which is a part of choroid plexus. This is the occipital horn of the lateral ventricle. Here we have sinus confluence. The sinus confluence is the transverse sinus. These sinus confluence are combined here. These are the veins of the brain, which are called sinus. So large veins of the cerebral connect here and create sinus confluence. This is the light transverse sinus on both sides. And the sigmoid sinus connects here. On the upper side we have the frontal lobe and the body of the lateral ventricle. On the first side we see the frontal lobe and the posterior lobe. Now we see the lateral ventricle. Now we see the body of the lateral ventricle, which contains CSF and choroid plexus. Then we have falx cerebris, which is the retina of the muscle. The retina is the brain, which is called falx cerebris. Then we have the postcentral gyrus and the occipital lobe. This is the occipital bone. Now we see the gyrus, fissure and sulcus. I will tell you the difference between gyrus and sulcus. Gyrus is the white matter in the brain. The tissues of the white matter are called gyrus. And the veins of the white matter are called sulcus. If we break the gums of the gums, then the gap between the gums is called sulcus. And the gums are called gyrus, which means the gums are called white matter. The gap between the gums of the two gums is called sulcus. The gums are called black signals. The gums are called sulcus. The white matter is called gyrus. The gums are called sulcus. Now we see the frontal lobe. The frontal lobe is called the brain. The occipital lobe is called the brain. Now you see that the inner part of the brain is dark and the outer part is white. If you can see that the inner side of the brain is looking dark and the outer side of the brain is looking white. So because in the inner side there is white matter. And white matter is composed of fat. We know that there is fat in the white matter. So the signal will be a little dark. And what is on the outside? There is gray matter on the outside. The peripheral side is gray matter. The original tissue is on the outside. And there is no fat in these. So these are very white. Now we are coming to the top of the brain. Now we see the frontal lobe and the fat cerebellum. These are the two parts of the brain. The precentral gyrus and the precentral sulcus. Here you can see the gyrus sulcus very well. The black spots are called the sulcus. And the brain tissues are called the gyrus. And there is water in the brain. I think I was putting this slide before. This is the previous slide of this slide. Here you can see the central semioval. The white matter in the muscle. And the gyrus and the occipital lobe. And this is the last slide of the brain. And here is the postcentral gyrus. The white matter is called the superior sagittal sinus. And what is the superior sagittal sinus? It is the supply of the brain. The sinus of the brain is the superior sagittal sinus. The parietal bone is the central sulcus. And here is the central sulcus. The gap between the white matter and the central sulcus.